Hi, I'm DeLaney Gabriel. I'm a holistic health practitioner in Santa Barbara, California. It is September 1st, 2019, and I'm here at the Cancer Control Society meeting in Glendale, California. And I'm talking with a woman who is president, CEO, manager, everything to do with American Metabolic Labs. And this is a lab with which I've been familiar with for 20 years. When your husband was involved in it, and unfortunately he has recently left us, and his wife is in charge of the company now and is taking over. So I'm doing this video for FaceTime because it's something that I really believe in. I believe in his work, Dr. Schandl's work, and just want to see whatever she is doing proceed so that patients will be able to still get the testing and everything that he had offered and that had been set in motion for so many years. So I'm going to ask Sam to introduce herself and to talk about her licensing and what she does in her practice, and then we're going to talk about some testing that is very beneficial to assess a cancer profile, just to find out a status, get some basic numbers, a baseline, and then it can be used for monitoring in the future. I've always found that through lab tests, better than a lot of other assessment modalities, that when you can see your numbers in black and white, then you integrate some changes to correct those numbers to get them better, and then you see the improvements come through, that people generally get motivated to take care of their health and stay on their programs. And is that about what you've seen, not only with this lab, but in your private practices?
Yes.
Yeah. So can you talk about those?
I'm Sam Needham. I'm President and CEO of American Metabolic Laboratories in Hollywood, Florida, and have the lab for 25 years. And as she said, my husband did recently pass, but I am carrying on his name and his reputation, and he did this work for 40 years, and I did not want it to see it go with him. I wanted it to be here because doctors and patients have been relying on these tests for all these years, and I wanted to continue it.
Yeah. And you're a colon therapist?
A colon therapist, a licensed colon therapist, licensed massage therapist, and licensed acupuncture physician in Florida.
Yeah. And how long have you been in the health field?
30 years.
30 years? Oh, a long time. And then how long have you been involved with the testing
25
part of
years.
that? 25 years. Okay. So we were talking about some of the testing that they have. And a couple of the tests that I'm just really, really happy about, an HCG, which we know is a pregnancy test, but when those numbers are high, it can be a good marker of cancer. So, and they do them both through serum and through urine. And then they have another test, which is PHI, that I haven't been able to test before because LabCorp doesn't have those, and it's a whole different thing. So will you talk about those to everybody out there?
Well, the PHI, we actually manufacture the reagent. Cigna had it many years ago, and we were probably the only ones ordering the reagents, so they stopped manufacturing. So they gave us the formula and the directions how to make it. So we had to buy a giant lyophilizer, and so we can freeze dry it and put nitrogen in there. And so it's a big process. It says about a 24-hour process just to make that. So we've been doing that for many years now.
And then the HCG.
The HCG is a pregnancy hormone. We do serum and urine, and our instrument can test at 1. It doesn't have to be elevated, and most laboratories cannot test below 2.5.
Right.
So between 1 and 2, you can have them. You can be showing that there's activity going on.
Okay. And you have a lot of doctors across the country.
Across the world, actually.
Across the world.
Yes, we're international.
Yeah. So I'm so glad that that's going, and that you're keeping that up.
Yes.
And then they have a longevity profile, which my clients who are listening, you'll be familiar with these. They do estradiol, testosterone, the IGF-1, of course, homocysteine, C-reactive protein, the high-sensitive one, and lipo-a, and then LDL. But you do an LDL direct.
It's direct, right?
And that's so that would be the fourth test. that I would,
cardiac markers,
yes,
right.
for cardiac markers, that's really important. And then of course the Chem 24 CBC.
Lipids. We do lipids.
And the lipids, yeah. So they have all of that, and then the cancer, and they also do TSH, which we have to do, and DHEAS, which is that adrenal marker, and and an anti-aging marker as well. So what else can you tell or contribute? Because I want people to, everybody who's listening, I want you to get these tests. And
Well, the HCG is the autocrine proliferation factor. It actually, when it builds up in the cytoplasm, it comes out of the cell, it docks to the cell, and it causes the cell to divide. The PHI enzyme, when that gets high in the cytoplasm, it comes out of the cell. It's the autocrine motility factor, so it comes out of the cell, causes the cell to vibrate on the tumor, and it dislodges. So when you hear about circulating tumor cells, it's most likely the PHI, or it's been surgery or biopsy. But the PHI is one of the biggest causes of cancer metastasize.
And my understanding, Sam, is that if these numbers come back high, it's a good indicator of cancer and of the immune system, but it's not necessarily specific to an individual organ. Is that right
That's
or not?
correct. That's
That
correct.
is correct.
To me personally, I think that's great because if you're using, like we did a study with women with breast cancer. We had 46 women. The traditional CA15-3.
Right.
We had one patient that it was positive, and these were biopsied for diagnosis.
Wow.
They were diagnosed by
Yes.
biopsy, and one of them had a positive CA15-3. All of them had at least one of the cancer profile tumor markers elevated.
Wow.
And actually, Dr. Schandl presented that in 2006, and he won a cash award for his presentation.
Oh, nice, nice. That's unusual.
Yes, yes.
Yeah.
And then we have the DHEA sulfate, which is an adrenal hormone.
Yes.
It's an anti-stress,
Right?
antiviral, anti-cancer.
Yes.
It's a youth longevity hormone, so
That's
it's
right.
a very important hormone.
It's a fountain of youth in my field of holistic anti-aging.
Absolutely.
Yeah.
And then we have CEA, which
Yes.
is carcinoma antigen.
Antigen, yeah.
It was originally developed to monitor colorectal cancer,
Yes.
but we see it elevated in breast cancer, prostate cancer, all kinds of cancer. So
I
it's-
look at that as a general.
right.
Yeah, where CA 19.9, some of the others for colon, lungs, and
The thing with the CA15-3, it's about a 60% accurate. So if you have a negative breast marker and you have breast cancer, there's no need to ever do it again because it's not reliable.
yeah.
And then we have the TSH,
Yes.
the thyroid stimulating hormone,
Right.
and that hormone is very important because if you have a low thyroid activity, you have low oxygen tension.
That's right.
And that contributes to an environment where cancer cells are very happy to develop and to live.
Do you happen to know the reference range that you have? Is it the standard 0.4 to 4.5 for TSH?
I think we have it up to 4.
Up to 4?
But I know Dr. Schandl didn't really like it above 2.5.
No,
So
me
he didn't like
neither.
it. He didn't like it above
Yeah, and Dr. Hertog, the dude from Brussels, the fourth generation endocrinologist, agreed with that, liking it somewhere between 1.8 and 2.2 on the high end, and really like 0.8. But who has those good numbers?
Unless you're on thyroid.
Unless you're already on that, and even if you are, if you're on Synthroid and levothyroxine and so forth, it's even doubtful it would be that good. Anything else you can contribute?
Well, the
to this?
GGTP is the liver enzyme that we're doing. We do that because a lot of times when a patient is doing treatment, a lot of times the liver can get involved, or sometimes it metastasizes to the liver. So we like to check that. And then, of course, we have the longevity profile, which you were mentioning in
Yes.
this test. So
Yes.
the longevity profile is comprehensive. Dr. Schandl would call it the full body scan without radiation.
Without radiation?
And actually, in Puerto Rico many years ago, a doctor came up to Dr. Schandl after the presentation and said, "What you're doing is biochemical fortune telling. You're telling us what our patients are going to become sick of 10 years from now.
wow.
We want sick patients now. You
Yes.
don't want to wait 10 years.
No.
You don't make money unless the
That's-
patients are sick."
Exactly, they've got to be. Yeah. So, anything else come to your mind?
does that cover cardiac markers in that longevity
She
profile?
mentioned
Yeah.
cardiac markers
Yeah.
in there, yes. Yes, we
The
do.
C-reactive protein.
The C-reactive protein, the homocysteine,
Yeah.
LDL direct, and LP little a.
Yeah.
So those are the ones that are not standardly done in a chemistry.
That's right.
When you go to a doctor, they don't normally do that, so it's something you need to ask for, but it is included in our longevity profile.
Yeah, and that's great because homocysteine is an amino acid that your body produces if you're anemic for a long period of time. And then your body overproduces homocysteine and it leads to a heart attack, cardiovascular disease. So that's a really important one. I'm glad that's in your panel. So you figured out so many great things.
And we also have PTH, which is
Yes,
for bone
talk
health.
about that.
So
Yes.
these tests can probably detect many years before osteoporosis, so we can see that someone's losing calcium from their body, from their bones.
Right.
Because you need calcium to buffer the blood, so it's important to see that. And then we have the sex hormones, which we mentioned before: the estradiol, progesterone, and the total testosterone.
So really good panel. So,
Yes.
well, thank you so much for taking this time. It's been 2 really long days here at this convention, and they have a booth that's nicely set up in the main convention hall with all the speakers and so forth. So, thank you again. It's been lovely meeting you, and I just wish you the best
Thank you very much.
carrying out this work. I can feel it's in your heart, which is why I wanted to sit down with you.
Thank you so much. I really
Yeah.
appreciate it.
So thank all of you for listening, and if you have any questions, you can call my office. I'll be managing to order these tests with some help from some doctors who will work with me on this. So just thank you and wish you all the best of health. And bye from Glendale for now.
God bless.
Yes.